Thanks for being there. Today we are talking about a topic that affects millions of women worldwide, cervical health. It is time to break the silence and start the conversation. So joining us is Dr. Ekemini Johnson, who will share insights on prevention, screening, and treatment. We'll be discussing HPV vaccinations, screening methods, treatment options, and addressing common myths and concerns. Let's empower ourselves with knowledge and take charge of our health. All right, let's get started. Dr. Ekemini, you're welcome to the show.
Thank you so much. My pleasure to be here.
It's nice to have you on set, Dr. Ekemini.
I didn't mention your position in the Medical Women Association, right?
Yes.
Okay.
I'm the Young Doctors Forum Coordinator National.
Oh, okay. Yeah. Oh, okay. That's nice. Welcome to the show.
Thank you.
All right, so let's talk about cervical cancer. Can you just take us through the basics? What exactly is cervical cancer? When we hear cervical cancer, what should we be thinking about?
Okay, cancer generally is just when a group of cells grow out of proportion. Generally, the body has a way of taking out bad cells and continuing with the good cells. So, and this is called cell cycle. So when there's a problem with that cell cycle, bad cells now begin to grow out of proportion. And so that's what we call cancer, basically. And the cervix is the part of the uterus where, I'll say just the lowest part of the uterus that opens into the vagina. So I'll just say if a baby, so in the pregnant woman, a baby that is lying, I'll just say straight or longitudinally, that's where the head of the baby lies. Yes. So that is where we call, that's what we call the cervix. And so when parts of the cervix or when cells of the cervix are growing out of proportion and they're not controlled, so we just call that cervical cancer.
So why is it a significant health concern?
Yeah, it's very, very, because globally about 500,000 women are being diagnosed of this disease yearly, and almost about 230,000 women die from this disease yearly. And it's even more so that it affects younger women more than the older women. And so that you are a woman, you are already, the risk is there that the possibility that you have cancer of the cervix is there. And because of the mode of transmission, and what is causing this, which is it's caused by what we call the human papilloma virus,
the HPV.
And this is sexually transmitted. And so once you're a woman and you're having sex, you could, I won't say would, you could have cancer of the cervix.
You made mention of being a woman is already predisposing you to this disease, right?
Yes.
But now you now said it has to do with sexual intercourse and all that. Okay, so we have younger women who don't endorse, so are they ruled out from?
Well, when you say young women don't indulge, now the age at which young people are having sex now is lower, and with our some of our traditions of early child marriages, sexual abuses. So you can't say you can't just rule the possibility out.
You have a point there.
I was going to ask when you say the younger people go down with it, how do they do so? But you just explained that. And then you said something about the cells being abnormal, so it's the abnormality of the cells that causes this. So what are the triggers?
Okay, so about 99% of cancer of the cervix is caused by being infected with this human papilloma virus. Like I say, it is sexually transmitted. And so the risk, so I'll just go into the risk factors, so that will now make you to understand more. So the younger the first age at sexual labor, the higher the risk, because what we call this, what we call the transition zone, that's when a woman is maturing, there's a part of the cervix that is yet to mature. So if she has sex below between 9 to 14 years, that's part of that cervix is not properly mature.
Okay.
So the risk of the HPV, that's the DNA of this virus, now getting into the DNA of cells of the cervix and now growing is very, very high. And also when someone has multiple sexual partners, the risk is higher because you don't know who has what.
Okay, yes.
You don't. And most times, with all respect to our men, the men are the ones that I'll say like
Promiscuous.
are the ones that
Okay.
I don't want to say share, but they are the ones that get the women
Right.
infected. Yes.
Most of the times.
Yes, most of the time.
But this is
So-
according to you, because I don't know if you have a data to back that. Let's be clear.
So even if a woman is not promiscuous and her partner is, she also stands the risk of having possibly having cancer of the cervix after being infected by the HPV virus.
Okay.
Yes, and then and of course, if the woman is promiscuous on her own,
Okay.
she also stands the risk of having the cancer of the cervix. Other risk factors include smoking and also multiple births.
Oh.
Because as you're with pregnancy and one delivers, there's some bruises along the cervix, and if the HPV virus is around there, it gets into the DNA of the cervix of the the DNA of the cells of the cervix, and then also could possibly cause cancer of the cervix. So those are some of the risk factors.
Okay.
Alright.
So for younger people, what would you advocate?
Okay, so now we're talking about prevention now.
Okay, we can call it prevention.
But before we do prevention, prevention
Yeah.
is quite far. How about the signs? How do you know
Okay.
you have these things?
Mm.
The screening methods. What are the screening available for young people to know that they have this or they don't?
Well, unfortunately, HPV virus does not show any sign of infection. It's when someone has the cancer of the cervix that the germ begins to show. So what are the signs? Possibly, for example, bleeding,
Okay.
prolonged bleeding, or that is prolonged menses, or bleeding in between cycles, bleeding after sexual intercourse, painful sexual intercourse, abnormal and foul-smelling discharge from the vagina, and waist pain and pain along, also like low back pain.
Okay.
That is if it has spread, you don't know. So majorly is bleeding and then abnormal discharge from the vagina.
Okay. None of these symptoms go without the other. Like you could have a prolonged bleeding. Sometimes your menstruation could take longer than normal. And does it mean when you have this, it's always and always cervical cancer?
Of course, everyone should know how long her menstruation lasts.
Yeah.
Yes.
No, what I'm saying is that if a woman has a prolonged bleeding during menstruation, let's say your menstruation is 5 days and you extend to 7 days or 8 days, does it always end that, or does it always mean that you have cervical? Are there other other illnesses that could take this symptom?
Yes.
Okay.
For example, polyps. That uterine polyps, uterine fibroids could cause this. Endometriosis could cause this.
Okay.
But by the time the bleeding pattern is different from what she usually has, it's good to check.
Always check.
Yes.
Okay. So all these signs, because I want us to be clear on the signs and the symptoms. Do they all come together? Like you have excessive bleeding, you have foul smell from the vagina,
Yes.
you have backache. They all come together, or is it one?
Now, these signs and symptoms are not specific
Okay.
to cancer of the cervix. They're not like specific. But the ones that are specific is abnormal bleeding, of course, compared to the usual bleeding.
Okay.
Increased in the amount of blood, that's bleeding too much.
Okay.
And then also foul smelling discharge.
Okay. Okay, so let's talk about the screening. I was asking, what are those screening available? Like, if you feel like there's any of these things, how do you get to screen for it? Like
Okay.
screening for cancer, what they call it, breast cancer, you go for the mammogram. So how do you screen for this?
Okay, we do a pap smear.
Oh,
Yes,
okay.
Absolutely.
Yes, pap smear. But before we, I think that before we talk about screening, we should look at, because screening is in stages. As
Okay.
in, there is what we call pre-cancer lesions.
Okay.
So if one does this screening on time, you could detect the abnormal cancer cells and treat. And it's also good to know that cervical cancer is one of the preventable cancers, and also one of the treatable cancers if diagnosed on time.
On time.
Yeah. So it's very, very preventable and also very, very treatable.
Okay.
So for the screening, we say, we advise that women that are 35 years and above
Okay.
should get a pap smear
35 years and above.
yes, and try to get this at least once every 5 years. At least once every 5 years. Now, women that have that have HIV or other immunosuppression diseases should screen from 25 years. That should get a pap smear from 25 years, because this cancer of the cervix, I'll say, grows faster in women that are immunosuppressed. So they should get their own screening from 25 years, and then try to get it 2 to 3 years after that. So every 2 to 3 years, they should get screened. And once the once the pre-cancer lesions is found, they should seek help and get treated immediately. But now, talking about because screening on time is also a means of preventing cancer.
Okay.
So, but I'll say the hallmark of prevention is the vaccines, because we have the HPV vaccines now, and
do we have them readily available?
Yes, and Nigeria also had taken the bold step to be among the countries that had launched the HPV vaccine. I think it was launched in 2023, and we've vaccinated a whole lot of young people. So the vaccine is best done before the female starts to engage in sexual intercourse.
Like what year?
Between 9 to 14 years.
Okay.
Yes. So now, depending on the brand, you can either take 1 dose covers or 2 doses.
Okay.
Could give a full coverage, but that does not prevent the woman from doing the pap smear. That's from doing the screening once she's 35 and above.
Okay, but that could help to prevent.
Yes, it could help.
Do the young ones do pap smear too?
No,
between 9 to 14.
No, they don't do.
So what do you use to? Okay, just vaccine.
Yes, you don't wait. It's just like your normal measles vaccine, polio vaccine.
Okay.
So they just get vaccinated, and it's best before sexual intercourse. So that's why we said 9 to 14 years.
Okay.
So how many doses of the vaccination can they take?
Take 2.
One. It depends on the brand.
Okay.
So 1 dose can cover, or 2 doses.
Okay. All right. When you mentioned age, I get kind of confused, because you talked about like we have child marriage, children giving birth at child what they call them, very low age, young age. Now, if a woman or if a girl gives birth at that age, should she still wait till she gets to 24 before going for the pap smear? I was thinking the pap smear should start from
Actually, cancer of the cervix does not just happen.
Okay.
No, because once one is infected with the HPV virus, the body kind of, shall I say, cures itself.
Oh.
Yes. So it is repeated infections with HPV, repeated infections that continues to happen, that the body cannot totally clear. That's now what stays to grow into cancer of the cervix.
Okay.
Yes.
Okay.
So it is not just one infection, but of course, well, I'm not saying that just one they say cannot cause it, but the possibility is quite small based on scientific evidences.
All right, let's deviate a little to the HPV vaccines now.
So before we deviate, how about the male? Do they take the vaccine?
Yes,
Yeah, okay.
Yeah, because there are other cancers of the males that are caused by HPV.
Okay. All right. So I remember when this vaccine was launched in Nigeria, and there were so many backlash. So I just wanted to find out. This is 2025, and that was 2023. 2 years. So what has the cooperation been like? Are people taking this vaccine? I heard of a mother who said she cannot introduce such a vaccine to her child who is just 10 years, her daughter. So we have those myths and people not agreeing to it. So what has it been like? Have people started taking those vaccines, or do you still have people arguing that they don't want it?
The issue with vaccines is that you always have the pro and you always have the cons in vaccinations. But there's what we did was that we worked, because there are people that the society looks up to.
Okay.
So the pastors, the imams, influencers that will say, yes, I have taken the vaccine and the vaccine is safe. Because the main, propaganda then was that the vaccine would sterilize the young women and they would be able to get
productive.
Yes, pregnant and all of that. So, but working through these leaders in the community, we have had a lot of successes. Actually, WHO wants to eliminate cancer of the cervix by 2030. That is that we should have less than 4 incidents, or that's new cancers in 100,000 women. So that means that at least 90% of people should have been vaccinated.
Okay.
But of course, for now, we don't have up to 90%. But at least we are not where we were before. Okay. So that's depending on some states, between 50 to 70% of people of girls have been vaccinated.
And is it free?
Yeah, it's free.
Okay, so I know Eddie asked for the boys now. In Nigeria, do we give the boys?
Well, I don't think the boys will be turned away if they are taken for the vaccination, but the drive was for the females. Yes.
Okay. And what's the age again?
9 to 14.
And that also applies for the male gender.
Yes.
Okay, so you said you don't know if they'll be driven, but don't forget that they are the ones who actually, like you said,
promiscuous, right?
Shared it. So something should be done.
No, definitely something is done. But since now, because we have different variants of HPV, so the one that is actually rightly implicated in cancer of the cervix is the HPV 16 and 18. So the vaccine is targeted to HPV 16 and 18. So it's kind of cancer specific. That is to the cervical cancer.
All right. So
yes,
let's go into the treatment. What was the question you asked last time? Was it the treatment?
No. We're talking about the before you talked about the symptoms, the preventive measures.
Okay.
So she's talked about the vaccine. I don't think there is any. Are there other means of?
Of course, there is what we call lifestyle modification. Every disease always has lifestyle modification.
Okay.
So I would say we need to take care of our children, because of course you can't leave your child with people that you don't know, because God forbid the child could be sexually abused, which later could possibly be a cause of that. Yes. And then also we should also train health workers to detect this problem on time.
Okay.
So that because lack of being able to diagnose this on time could lead to more women dying. And just before I would say that prevention is always primary, secondary, and tertiary. So the primary one is try to keep your children safe.
Okay.
That's 1. 2, we should talk about policies that would completely remove child marriage. But of course, that's still a long way to go.
That's open for debate.
Yeah.
It's open for debate.
So and we as parents, we should not encourage it. As in, by no means should I give up my child when I know that she's obviously a child, she's not of age, and then I'll now try to get her married because of some economic value that I will stand to gain, and so laws preventing that, which I know is already in place, should be enforced.
Okay.
So it should not just be on paper; it should be enforced. And then also screening for this cervical cancer should be part of insurance. That is, it should be free. People don't have to pay because it's quite. I think it's about between 10 to 15,000, about that.
Okay.
So people should not have to pay for that. Something as important as that, because most people may not be able to afford it. So it should be part of the insurance policies, and it could even be part of the routine screenings. Just like I remember when we had so many cases of HIV, and it was now part of routine screening. So once a person comes, the person is tested, and then treatment is offered, and then so that is about the primary prevention, and then people should eat healthy, of course, eat healthy, exercise, just stop smoking and alcohol as much as you can, because those also are implicated, yes, in cancer of the cervix. And then also on that, for the woman now, try to get screened. Even if you say, I don't have money, this is something important, you could save up for it, and then you have children, get them vaccinated. You too also be vaccinated, because of course women that have been exposed to sex too could also be vaccinated.
Oh really? Yes. I thought there was no.
No, they can also be vaccinated.
Okay, we take some tweets to see if we can change the course of our discussion a little. Okay, so we have our first tweet here from WHO, and it says cervical cancer can be cured if diagnosed and treated at an early stage of disease, which is what the doctor had said. Women should see a healthcare professional if they notice the following: unusual bleeding between periods, after menopause, and after sexual intercourse. Now, increased or foul-smelling vaginal discharge. Symptoms like persistent pain in the back, legs, or pelvics. And then weight loss, fatigue, and loss of appetite. Okay, vaginal discomfort, swelling in the legs. So if a woman should observe any of this, what they call them now, signs, it is high time to visit the healthcare center. Okay, so our next tweet says, when was the last time you had your pap smear test? Regular screening helps detect cervical changes early and can prevent cervical cancer. Okay, I think that's all. We know it's a good thing, but just like you said, the cost of it's what is stopping so many persons from doing these things, and lack of education. Even if some persons might have this money, but they do not know they are supposed to do this. So when we talk about awareness, what do you do, especially in your women organizations, to create more awareness about cervical cancer?
Okay, we are. I think M1 is all about cancers and cancers. So we do works like we do like M1 Aquibum does screening every third Tuesday of the month, where we screen the cervix and also do a clinical breast examination.
Okay. Yes. Every Wednesday, you said?
No, every third Tuesday.
Okay, every
third Tuesday.
Where do you do that?
That's at 127 Atiku Abubakar. That's our secretariat here.
Okay.
And then also we also go into villages, churches, and give talks about healthcare, cancer of the cervix, breast cancer, and also offer screenings if we are sponsored. We do that a lot. And we've also had champions. These are very notable people in the society that could influence people positively to get screened. So we have so many champions, traditional rulers, heads of churches, even the Honorable Commissioner of Health is our champion
Okay.
that champions our this also this talks about screening and all of that, and we've partnered with a lot of people, even including Ibum. A lot of people have met with us, and then we've done a lot of screening and also awareness. And talking at the national level, we've also done a lot because we have N1 in other states, and they are doing a lot that I can't even just mention here on cancers, and but most especially on female cancers, breast cancer, and cervical cancer.
Okay, so with this partnership, I'm glad you brought that in. Do you have a database to know the statistics of awareness of how are people aware, having done this awareness?
I wish if I had known that I would be asked this.
You'd have come with the data.
Yes, no, but we do a lot, and we published that also in some journals. We've done a lot. That. We have.
It's not enough to say. You want to continue with your questions?
Yeah, because you know why I asked, so that as they do this, they could have a feedback to know how informed people are and if they are complying to lifestyle, like you mentioned. And
to compare, this year with the population, this year, to know if there's progress or if there's...
And then reported cases too, to see if it's on the increase or there's a reduction and all of that.
Cancer register at our facility, and we publish it every year. We do that. Just that I didn't really check the...
So you don't have the exact figures. Yeah. So during the tweets, you saw the signs, one of those people listed. Are there more you could add to? Or did the person exhaust all the signs one could have?
The WHO actually exhausted most of the signs that are specific to cancer of the cervix, which is just say abnormalities in bleeding patterns, and then also abnormal renal discharge, low back pain. Weight loss is not specific. Loss of appetite is not specific because that could happen in any other disease. And then leg swelling too is not specific. But once you see that one's menstrual cycle is going haywire, please just go and get screened.
All right, so now let's talk about myths, because we always like to talk about myths, especially when it comes to health issues. So can you just give us some of those myths and misconceptions and those ones you would like to debunk?
Okay, well, there's a lot of myths that's one is about I would say the menstruation issues that one woman is menstruating, that she cannot contact HIV virus. Of course, it's not true. It's not true because there are some men, although culturally men would say they don't engage in intercourse during menses. But if you have sex and you're menstruating, please, you could contact the HPV virus. Yes, it's possible, and so be safe. And then also another myth is that you could that the more sexual partners you have, that it does not matter. That clearly is a myth, because the more sexual partners you have, the higher the risk. So I would say abstinence, if you are not married, is the best. If you have a partner, be faithful and let your partner
also be faithful.
Because this also now takes me to the third myth, that if a woman is faithful and then her partner is not faithful, that she can't get the virus. It's not true, because you definitely get it.
So what would be your advice to a polygamous family, a man with many wives, knowing that this is legal, and then the man will only stop at his wife, so would probably,
I would just tell the women, go and get your pap smear. Check yourself.
Keep doing your screening.
And treat if there's any precancer lesions. get your daughters vaccinated, you too get vaccinated because you have to live.
Okay.
So you said if detected early, cervical cancer can be cured.
Yes,
Does it reoccur? Like if you're being cured once,
it goes.
That's all.
It's actually, yes, it's one of the treatable cancers. So
Treatable cancer.
yes, so
Okay,
once it's
Detected.
early, it can be totally eliminated. Yeah.
Good to
So
know.
when you say detected early, what's the window for contacting it and then maybe
Okay, well,
getting...
the thing with cancer is that it can stay for 10, 15 years, it won't show any sign. By the time it now begins to show, it has spread to other parts of the body. Yes. So that's why that's why the pap smear is very important. So if it's noted before it becomes full-blown cancer, and then also even if it becomes full-blown cancer, there are stages too.
Okay.
So depending on the stage that it is found, it can be treated stage 1 and I think stage 2 too. But once it passes that, it becomes
Deadly.
something else. And cancer treatment everywhere is very, very expensive. It affects the person that has the cancer. It affects the caregivers. Even affects the community. So prevention is always key.
Now, talking about prevention, how do we as women care for our cervix? Because
How
it's
do
key
we?
so that we don't, let us
No,
in.
because cancer of the cervix is primarily caused by HPV, although there are other causes.
Okay.
So how do you care for your cervix? I'll say one, you start caring for the cervix actually starts when a woman is young enough. The mother should teach a girl child about menstrual hygiene.
Okay.
Because if you don't wash your undies well, you don't know how to take care of yourself, that could lead to infections. And cancer of the cervix, or I'll say HPV infection, gets more virulent or progresses faster in the presence of other sexually transmitted infections. So you have to be careful.
That's something you've just said. Now we're talking about menstrual hygiene. Also, not the lack of menstrual hygiene could also predispose one to having this form of cancer.
No, it won't. But of course, as in, if one's immune system is low, fighting disease one after the other, once
becomes tough.
HPV virus now comes in, the body is somehow overwhelmed. So you don't want to go that route. And also to talk about care of the cervix, I would say all this douching is a no-no.
Okay.
Because what it does is that I'll say it's not healthy for the cells of the cervix. So just wash with water and that is fine, because you need those micro organisms to fight off whatever that comes in there. And by the time one douches, you are killing them. You are making the cervix to be free of the normal flora. So something else has to come and stay there. So possibly, God forbid, may it not be HPV virus.
Oh my goodness.
Then also, yes, also you have to also do your screenings. And it's about caring of the cervix. You have to do your screenings. You have to use undies that are breathable cotton. Yeah, so that, because just to keep the place clean and airy. You also have to use condom, because condoms too have some shall I say degree of protection against STIs.
Okay.
Because once you have other STIs, it worsens HPV infection. And then still caring for your cervix still means that you have to be faithful to your spouse and to your partner.
Okay, so now let's talk about a call to action, because we don't have much time, we have to go. So what advice would you give to women out there, generally, as we mark this year's day of cervical cancer elimination.
So, call to action, I would say, I have been vaccinated. I don't know, have you been vaccinated? So
were you vaccinated when you were? Okay, it just came in 2023.
Yes.
So
yes. So
when did you? Okay.
No, it did not just come in then, but it was.
It gained prominence.
Yes, because people have been doing this.
But it was way expensive then. Yes.
To do that took about almost 100,000. So, but now it's free. Yeah. So you can see that God has helped us with that.
So Young, have you been vaccinated?
Oh yes, Nancy. Let me disappoint you. I was disappointing. So Nancy, Doctor and I have been vaccinated.
I have been vaccinated. I have been vaccinated. In fact, when it came out 2023, because we had a guest here that same year who talked about the introduction. That was when the federal government was about to launch it. So we were so excited because before then it was like it's only for the rich. If you have enough money, you go and do that. So when it came, everybody was excited, and I'm one who preached vaccination.
Especially, have you made plans for your daughter too?
Yeah, of course I'll do that for her. That was when I even got to know that so many parents were against it. They had so many misconceptions about it, and that was why I asked her that how is it now and then. The refusal to take it, the misconception, are they being cleared? When you go out for your advocacy, when you go to talk to people, did you tell them?
Yes. Yeah. What we do is that, like we go with our own children and say, I have vaccinated my daughter.
Okay.
So I can't love my own daughter, or I can't hate my own daughter more than you.
Any other person.
So if I have done this, it means I'm safe.
Okay.
And so they see that and they're encouraged.
Okay.
And you give your children opportunity to talk about it?
Talk about it and said, yes, I have been vaccinated. And so other children see that and they're encouraged to. So I would say, call to action, vaccinate yourself, get screened, do your pap smear, get your girls vaccinated, and then preach the word for others also to get vaccinated. And of course, as much as you can, because since it is sexually transmitted, use condom. You cannot stay away from sex. You can stay away. Abstinence is key.
Yeah, I was about asking.
Abstinence is key because we would always we always like to go to the extremes of both sides. You cannot stay away from sex. Protect yourself. Get vaccinated. Do your pap smear as much as you can, at least every 5 years, yes. And then one that has HIV, it's every 2 to 3 years. And then you can stay. Abstinence is best.
Okay.
Be faithful to your partner, and then continue to preach the message to others.
So for those who can abstain, they don't have anything to do with the immunization, or they can still take it?
Well, I would say go and take the vaccine.
Okay, abstinence or no abstinence?
Because as long, except you have sworn to celibacy, you are saying, I will never have sex again. I don't know, ever.
Then you are good to go.
Then you are good to go. But HPV virus, we have other cancers that are caused by HPV virus.
Okay.
So not just cervical cancer.
Okay.
So once you are vaccinated, it could also come up with other cancers.
Okay. All right. Thank you so much, Dr. Johnson, for coming on the show today and for sharing your insights with us today.
My pleasure.
Educated.
Thank you, Doctor.
All right. So to my audience, let's prioritize our health and well-being. If you have any questions or concerns, speak to your healthcare provider. Together, let's make cervical cancer a priority. Thank you so much for joining us today. And so from all of us here is bye-bye for now.
Bye-bye.